career in nursing has enormous variety. Nurses work everywhere. Private homes, small clinics, large hospitals, and there are many specialties. To give you an idea of whether nursing may be the career for you, we spoke with a registered nurse to find out more.
My name is Tammy Burrows, and I'm a registered nurse at the Misericordia Hospital in Edmonton, Alberta. I graduated from Grant MacEwan College December 10th of '99. Worked in medicine for a few months and then took the ICU course through the Royal Alexandra Hospital, and I've been in ICU for the past 8 years. It started when I was younger and my grandmother showing me how to make hospital corners on beds. And I went into nursing in Sault Ste. Marie, Ontario. And what really cinched it was we went to a retirement home, and it was my turn to take someone's blood pressure, and it was the first time that I'd ever taken anyone's blood pressure. And this elderly gentleman who didn't speak any English looked at me and he squeezed my hand and he smiled, and I was hooked. I had to be a nurse.
Good morning, Mr. McLeod. My name's Tammy. I'm going to be your nurse today.
Nursing is a 4-year university program, and it's a portion of theoretical and clinical practice. You're in the classroom for a couple of months, and then later you are placed in a hospital on different units or in the community. And it gives you a nice wide variety of what you want to do, and then it also gives you an overall picture on how you can help families and their loved ones. A typical day in the ICU, there are no repeats. It's quite different. You start off with your assessment. You make sure that all of their medications are given. You go through any of the doctor's orders. You plan with the interdisciplinary team what your plan is for the patient. You also inform the family along with the doctor of how their loved one is doing. You prepare for your tests. You make sure that you're doing your assessments quite often. We do hourly vitals and Q4 assessments. We're very busy. You also have to chart all of this down, and if a new admission comes along, you do have to take that admission and start all over again.
Okay, Volante, we need the Cardioverter and VTAC 184.
Typically in the ICU, it is a 1-to-1 ratio of nurse and patient. Our patients are very critically ill, and all of our attention has to be on them. If the patient is getting better and they are not as acutely ill as what they were before, there is a possibility that I could have 2 patients, but the majority of the time I do have 1 patient, just because that they are critically ill and they need the attention. Some of the equipment that we use are the ventilators, and this is to help the patient with their respiratory status. Sometimes they will breathe along with the machine, or sometimes the machine will breathe for them. We also use a lot of IV pumps depending on how many infusions the patient has going at that time. Sometimes our patients require dialysis, and we use the PrismaFlex, which is continuous renal replacement therapy, and this machine works as the patient's kidney. So the machine gets hooked up. It takes the blood from the patient, cleans their blood, and then gives the patient back their blood.
Thanks. Okay. Have a good sleep. All right, thanks.
Yeah. Not every registered nurse has the same work schedule. There is shift work. I work days and nights, so 12-hour days and 12-hour nights, 4 on and then 5 off. So I essentially almost get a week off every time. Some people prefer to work just days, some people prefer to work nights, and others prefer to work evenings. There is a wide variety out there for someone to choose. For the work-life balance, it is much easier than I had anticipated it would be. Though we do work 12-hour shifts, we do get enough days off, and family is very important to me. I see them every single day, in the morning before I go to work and at night when I get home. There are a lot of things that we do. We travel quite a bit. We go fishing, we play golf. We're big hockey fans, and I love spending time with my husband and my 2 stepkids. As an RN, there are many opportunities for you out there. You can work in Canada, you can work from coast to coast. You can do community work, work in peds, NICU, adult units, the medicine units, the surgery units, and with the surgery units, there are general surgery units, ortho units, and also the ICU and the CCU. And it doesn't stop there, that you can get out of the hospital and work community. You can be a nurse at a school, you can be an instructor, you can be a manager, you can be a supervisor, you can also run the hospital if you wanted to.
He is doing much, much better once we're able to take the breathing machine off.
Someone who would make a good RN is someone that can speak to people they don't know, but they have to be able to listen. They have to be a patient person, loving, caring. Being a well-rounded person and someone who does listen and is able to advocate for the patient is someone who is usually a bridge between the doctor and the family. There's a lot of times that you are explaining things to families that the doctor had just gone through in a conference, but the family only hears the first sentence and they're confused and they're scared and their loved ones are laying in a bed. You need to be there to help the family and to help the patient. I love my job. I wouldn't have done anything else, and I don't know if I would have been happy doing anything else. You look forward to going to work every day. You look forward to the people that you're working with, and every day is different.
To become a registered nurse, you will typically require 4 or more years of post-secondary study. If working as a registered nurse interests you, there's more information available, including salary ranges and educational requirements in the occupational profiles on ALICE. You may also be interested in the related occupations of nurse practitioner, licensed practical nurse, respiratory therapist, or community health nurse. Learn more on the ALICE website and make the most of your future. Visit us at alice.alberta.ca.